Hello everyone, this is Lourdes Caballero, Doctor of Nursing Practice student at Maryville University. This is the DMP project presentation entitled Implementation of the Mini-Addenbrooke Cognitive Examination. I would like to thank my community members that includes my chairperson, Dr. Rita Wunderlich, whose knowledge and expertise as a mentor helped me through the process of achieving success in this endeavor. Dr. Wunderlich has been an exceptional guide and resource since we started working together on this project. I would like to also thank Jessica Medrano, my community support, who assisted me and gave me tremendous support and encouragement when times were hard. And I want to thank the second reader of this project, Dr. Davis. Now let's talk about cognitive impairment. Cognitive impairment as a mental health condition has been a cause of disability and decline in life quality. Cognitive impairment and dementia has been a has have a devastating impact in family members, caregivers, and have a negative impact on patients. Therefore, my interest would be motivated to seek solutions by implementing this project. Prior to this project, there had been inconsistent screening practices for cognitive impairment in outpatient mental health clinics. Patients only were screened when self-reporting memory problems. The proposed solutions consist in implementing the mini-A's and the Mini-Addenbrooke cognitive examination for early detection and treatment of cognitive impairment. The purpose and aim of this project is to implement mini-A's as a routine clinical practice to detect early mild cognitive impairment and to initiate early neurology referrals. Prior to this project being implemented, patients were only screened when self-reported memory problems. Research addresses the need for more consistency in valid tools for screening cognitive impairments in patients 60 years and older with mild to moderate major depressive disorder. We address these weaknesses by implementing the Mini-A's as a routine screening tool for cognitive impairment with the goal of improving early identification of cognitive impairment and increasing neurology referrals. This project is backed up by a global increase of cognitive impairment and dementia. Challenges of include timely intervention and diagnosis with the potentially of mini-A's to reduce the burden of cognitive impairment. Currently, there is a lack of screening tools which are reliable at mental health clinics, which present challenges at the chosen clinic, which it is low referral rates that are causing to be a delay in identification of mild cognitive impairment. The significance of this project is that mild cognitive impairment and depression in aging people are not isolated cases, but rather a widespread issue that transcends social classes, ethnicity, and gender. This underscores the urgent need for early cognitive screening for patients with depression. The outcome of this quality improvement initiative is to implement the Mini-A's screening tool as a significant step towards improving healthcare for the aging individual. It can potentially increase early cognitive impairment detection and enhance the rates of neurology referrals, offering a brighter future for patients' healthcare compared compared with the present clinical practices. The literature review has provided a solid foundation for supporting the development of this DMP project, which aims to determine if implementing the mini-A's will improve early detection of cognitive impairment among the elderly and increase neurology referrals. We use library resources at Maryville University Library, Mainline, Croquet, Cumulative Index to Nursing and Allied Health Literature. The criteria for searching was limited to English language peer-reviewed articles published between January 2015 and September 2022. The results of the research initially yielded 436 articles, of which 64 articles were refined and 26 articles were appropriate peer-reviewed articles. The selection of the article were grouped into the following themes: incidence of risk factors, evaluation of cognitive function, and mental health and improving patient outcomes. Now let's look at incidence of risk factors. Age has been linked significantly to the cognitive impairment. There's other neurology disorders such as Parkinson's disease, stroke, vascular dementia, and Alzheimer's disease, as well as brain injury as primary causes of cognitive impairment. The level of education is also related to um, cognitive impairment, considering that better cognitive research is considered to correlate to higher education. So social isolation and lifestyle are also considered risk factors, including alcohol, poor diet, and smoking that increases this risk. Last but not the least, environmental toxins and genetics. With family history, the apolipoprotein 4 allele and exposure to toxins increases the chances of the risk of mild cognitive impairment. Now let's talk about evaluation of cognitive function. In bipolar disorders, schizophrenia, and major depressive disorder, cognitive impairment is prevalent, with um, major depressive disorder being prone to showing symptoms that are prolonged and persistent beyond episodes of depression. Other people with major depressive disorders show difficulties in decision making, memory, loss of memory, and poor concentration, different from those expressing depression only. Cognitive impairment and depression are related to increasing rates of mortality, morbidity, and disability, especially in patients 60 years and above. Improving patient outcomes. Early diagnosis and screening consists um, or is a constant intervention that improve patient outcomes, as well as management of medication. When adjusting the medication based on outcomes of many A's, results for reducing cognitive decline. Cognitive stimulation is also related in providing or improving patient outcomes, since aligning the activity with cognitive abilities maintain a sharpness of mental stability. Now I would like to take a look at the theoretical framework used for this project, called Lewin's theory of change. Using Kurt Lewin's theory of change, the outpatient mental health and psychiatric services clinic will implement the mini-ACE screening tool in patients 60 years old and above diagnosed with major depressive disorder. The framework consists in three phases of change model that are represent, changing, and unfreezing, which guide the implementation in improving referrals and detection of cognitive impairment. The application will be according to the education provided to practitioners on the effectiveness and ease of use of mini-ACE, which enables the adoption of evidence-based practices in outpatient mental health clinic. As outcome of this application, there's going to be an improvement on patients through early identifications of cognitive impairment and improving the rates of neurology referrals. Let's let's look at the methodology. This academic project will be conducted at an outpatient behavioral health office in a county of a southeast region of the United States. The sample will include the electronic medical records of patients diagnosed with mild to moderate major depressive disorder. The study will focus on all races, genders, and cultural backgrounds of patients 60 years old and above. The mini-ACE will be implemented as the screening tool to assess cognitive impairment. The mini-ACE has demonstrated high internal consistency and provided superior accuracy than the mini mental state examination. There's worldwide issues of cognitive impairment, dementia, and depression across all demographics that are affecting other people, constantly reducing their life quality and causing disability. This qualitative improvement research aims to evaluate whether implementing mini-ACE improve early cognitive um, early detection of cognitive impairment by implementing and enhancing the rates of neurology referral for people 60 years of age and older in the southeastern United States. Mini-ACE will be used as the main screening tool. The authenticated screening tool Mini-ACE is implemented since its cutoff scores is high for specificity and sensitivity, which is less equals 25 out of 30 and less than equals 21 out of 30 at the chan- as the chances for dementia. Also, it has an accuracy that is high, sensitivity with a sensitivity of 95.6%. Let's talk about project design. This is a qualitative improvement initiative research with quantitative exploratory design using a retrospective review. The setting will be for this research, it is in southeastern United States outpatient behavioral health office, and the participants are people 60 years of age and above with from all cultural backgrounds and ages. The project designs participants um, were 60 years and above, with attendance documented between January 1st to June 30th of 2024 at the Behavioral Health Clinic. Electronic medical records eligibility must show that the patient diagnosed is an outpatient with major depressive disorder having undergone post-interventional education or mini-ACE screening. In addition, 22 to 25 patients scored for electronic medical records on the mini-ACE and were referred to an evaluation by a neurologist. That are going to be the inclusion criteria. Patients with electronic medical record already diagnosed with cognitive impairment are going to be excluded. Also are going to be excluded patients that are below younger or younger than 60 years of age with other mental health conditions a part of major depressive disorders. Now let's talk about data collection. Mini-ACE is reliable and validated tool. It is a reliable and validated tool that detects mild cognitive impairment, thus ensuring consistency and preciseness of results. Researchers confirm its internal consistency and reliability, which is a stronger integrated, making Mini-ACE an efficient screening tool for older adults, especially those with moderate or mild depression. Mini-ACE validity is enhanced via standardization and repeated data collection procedures, which is vital for addressing growing concerns of practices in clinics. Now we'll take a look to protection of human subjects. The research is adhered to the standards of ethics by following the institution protocols, ensuring that the patient's information is confidential and using anonymized data. It was exempted from its full review by IRB due to its status as a quality improvement initiative. However, all the data were stored securely and the patient's identifiers were removed in compliance with the HIPAA regulation. Using the screening tool of Mini-ACE reinforced the research conduct of ethics by providing a detailed examination of mental health, further ensuring an approach that is patient-centered as rights, dignity, and truth, which are specific values, are upheld. Now we take a look at data analysis. The data analysis is important because it provides an overview of the descriptive statistic that uses quantitative methods and variability that are essential for the project results. A C-test statistical tool will determine the difference between two proportions and compare two fractions. Neurology referrals before mini-ACE intervention and neurology referrals after mini-ACE implementation. The process of neurology referrals increased post-implementation compared to the pre-implementation timeframe. There were There were 77 patients in the pre-intervention group and 76 in the post-intervention group, since one of the patients of the mini-ACE scored as dementia. That patient was excluded from continuing into the data analysis and results. The pre-implementation sample of the mini-ACE comprised 77 elderly patients with 17 male patients and 60 females. Similarly, the post-implementation sample of the Mini-Aids comprised of 76 elderly patients with 17 male patients and 60 females. The patients' ethnic backgrounds comprised 9 Caucasians, followed, followed by 11 African Americans, and the largest were Hispanic for pre-implementation. In comparison, 11 were Caucasian, followed by 12 patients African Americans, and the highest population was 54 Hispanic for post-implementation, but there were no other unknown ethnic groups. Since the research had no missing data, it maximized the data collected when designing the research project. Patients were extracted from electronic medical records. Now let's look at the discussion results. This session is at large the most important part of the project because it summarizes the and presents the findings of the project and answers the initial PICO question. There was sufficient information that showed an increase of neurology referrals from pre to post implementation of the Mini-Aids. The results showed that routine screening for mild cognitive impairment promoted early detection, increased neurology referrals for timely treatment, and improvement of patient outcomes. Now let's look at implication to nursing practice. Improving early detection of mild cognitive impairment, whereby Mini-Aids application in nursing practice allows early timely intervention, which may avert or delay extra cognitive decline. By enhancing patient outcomes through early cognitive impairment identification, healthcare service providers can swiftly ease the prompting of neurology referrals, thus leading to more efficient strategic management that can improve the quality of patient living with mild cognitive impairment. Let's look at implication for to future research. Future researchers should emphasize the Mini-Aids application across numerous patient demographics to best use its effectiveness in assessing cognitive health routines. Future research should assess whether early referrals lead to better patient outcomes and reduce the cost of healthcare in the long term, examining whether early identification affects both the system level's efficiency and personal health. The practicality of the Mini-Aids, which is with its user-friendly design and ease of implementation, not only reassures healthcare professionals about its usability in their clinical settings, but also instills a sense of confidence in its effectiveness. The research strength lies in its real-world application, which measure the post-implementation systematic changes, such as the increase in neurology referrals and the accuracy of diagnostic tools. It connects the practical impact and theoretical effectiveness by focusing on the validity of the diagnosis. The research findings show that above enhancing the identification, Mini-Aids can facilitate design healthcare responses that promote intervention at an early stage. The research concluded that Mini-Aids significantly improves the early identification of mild cognitive impairment that increases neurology referrals and increases neurology referrals. This outcome, which aligns perfectly with the research goals, not only provides a sense of reassurance and confidence in the research, but also highlights the pivotal role of mini-A's in raising the standard of care in cognitive health assessment. It demonstrates that Mini-A's is not just an effective tool for assessing mild cognitive impairment, but a game changer that sets a new benchmark for cognitive health assessment, instilling a sense of confidence in the audience about potential of Mini-A's and its impact on patient care. Here is the references for this presentation, and we are open for questions and answers. I appreciate your time um, for listening to this project, and thank you all for your attention.